This episode is brought to you by Switchboard MD, founded by physicians and data scientists. Their AI platform restores the human connection to medicine with impressive results: 83% faster response times, 45% reduction in inbox workload, and 97% accuracy with zero staff training required. Switchboard MD helps clinicians focus on patients instead of administrative tasks, giving providers more time to deliver quality care. Learn more at thisweekhealth.com/switchboard-MD. Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
Welcome to our executive interview with Dr. Blake Anderson from Switchboard MD. Dr. Blake Anderson is a physician, innovator, and a healthcare technology leader dedicated to improving clinical workflows through AI and digital transformation. As the founder of Switchboard MD, he focuses on optimizing provider communication and streamlining healthcare operations with cutting-edge technology. With a background in both medicine and health IT, Dr. Anderson brings a unique perspective on how AI can enhance efficiency while maintaining high-quality patient care. Dr. Anderson, welcome to the show.
Thank you for having me.
I would love for you to share a bit about your history and journey in medicine and what led you to creating this organization.
Sure. So I'll go probably pretty way back and all the way into the undergrad territory where I did the pre-med work, but also did computer science. Always had a lot of interest in programming and solving random solutions that way. And as I went through med school and residency, I found myself continuing to drawn into the IT world. And probably the biggest kind of transition point I had was I did a year post-residency where it was chief resident quality and patient safety, where I did a lot of operational work and got familiar with a lot of the healthcare data. Just took off from there. And I found that it was usually a lot more efficient being directly in front of the workflows and the problems to help to solve the problems from that perspective, rather than trying to explain the workflows and things like that to external people. And fast forward a little bit, I had a very busy practice at Emory, and I found that it was getting harder and harder to see a full panel of patients and then also respond to a bunch of messages at the same time. And there wasn't really any great native solutions to solve that problem. And so I ended up training a NLP classification algorithm to solve the problem, get the message to the right person immediately.
When you think holistically about the problem that Switchboard MD is solving and how it fits into the broader healthcare IT ecosystem, what's important for people to know?
Yeah, so I think that there's been a lot of increase in the amount of digital engagement from patients. And I think that in a lot of ways, it's very positive, right? It lowers the barrier to entry for patients to get in and communicate with their physicians and other members of the care team a lot faster. I think that the part that people don't necessarily realize is how much back and forth that exists when these messages and other forms of communication get initiated. And so I think that what we have been able to do is knowing what the workflows are and being able to shortcut a lot of those inefficient steps can really drive a lot of value for both the patients and the providers, because the patients get faster response to their messages because they're not having to wait for messages to get bounced around to 5 different people. And the providers and other nurses and medical assistants, they can focus on more specific tasks.
And you recently had an article published in the New England Journal of Medicine specific to development and evaluation of a model to manage patient portal messages. When you think about the integration of AI into clinical workflows, what do you see as the biggest challenge in operationalizing AI for frontline providers?
Sometimes the integrations, specifically with patient messages, the integration is possible, right? It's just a matter of getting to work with the right person in the healthcare organization that has the access needed to, we call it connect the plumbing. I think that's the biggest issue. And this has been done by a lot of different people. And I think that some of these complex integrations, that is. And I think that crossing into that zone of saying this is okay to do this integration, I think is one of the bigger hurdles.
What aspects of AI adoption do you believe are overlooked in discussions amongst healthcare leaders?
So I think that honestly, one of the biggest challenges is there's a lot of shiny objects out there. And I think that there's sometimes a disconnect between where the decisions are being made and what are the true problems at the ground level. And I think that the attraction to the shiny objects can sometimes distract from what's going to really drive the most impact on the day-to-day workflow of people. And I think that part of the issue is, I think that there's been a reliance on older technologies like Excel spreadsheets to maintain workflow decisions and things like that. And a lot of times people are reluctant to let go of those. And I think also some people necessarily don't understand how much is dependent upon having a spreadsheet or a PDF or a PowerPoint that was created however many years ago for people to go through and be like, if this, then this, then that, and that.
One of the wins is that as a physician, you built the product, but your article also highlights the importance of usability and physician trust in AI. How can a healthcare system or an executive who's not necessarily the physician ensure that AI tools are built with end users' needs in mind?
Yeah, so I think the way we handle this is we do user acceptance testing very early in the process and make sure that the operational leaders and clinical leaders are okay with how we're handling certain categories of messages. And then I think it has to be a continuous process. And I think you have to be able to keep logs of what's happening to every data transaction that occurs and being able to go back and retroactively assess the accuracy. Having those safeguards in place, I think, is very important.
With so many healthcare systems struggling with data quality, interoperability, even the governance factors around usage of AI, how can you use it to overcome the challenges that they're trying to solve?
I think that one of the key benefits we have at Switchboard is the data quality is solvable. It's just challenging at times to make sure that you are getting consistent data, even if it can come from different sources. And I think it's the most important thing is investing that time up front, making sure that the data you're pulling in to start with is clean and consistent. I mean, you have good safeguards in place for monitoring both the quality of the data that's coming in as well as the outputs of the AI.
So AI is now making, in some cases, clinical recommendations, and there's a ton of discussion around both bias and fairness. How do organizations ensure that their models are equitable and safe for all patient populations?
So it's a little bit challenging. It's easier when it's structured data to assess and make sure there's no biases. You can go back and retroactively look and make sure there's no drift for certain populations based on age, race, gender, and things like that. It's a little bit more challenging when it's unstructured data, which is what we're primarily utilizing is unstructured data. And so the double-edged sword there is that we're not introducing any sources of bias. We're not like including any of the demographic data to begin with. We're focusing primarily just on the text. But I think the other way that you counteract that is having stakeholders that represent different types of backgrounds who can help to validate that it is in fact being applied equally.
You've created a product that solves for now and for the future. How do you believe that it will influence the clinician-patient relationship? Let's just say the crystal ball effect of maybe the next 2 to 4 years as well.
Yeah, so I think that what I was alluding to earlier, as far as the ultimate goal is to make that communication easier. And so for the patients, I think it's great to have less of a barrier to entry. And I think, but the only way to have really the most benefit for this is to make it less burdensome for the clinicians. And the way we do that is by making it easier to do that. And I think that our primary focus has been first on making sure that the physicians aren't being distracted by messages they don't need to manage. I, as the doctor, I literally can't schedule appointments. Well, I probably could, but I would have to figure out how to do that. And so like, I shouldn't have that in my inbox. And I think that once we can declutter all the kind of unnecessary administrative tasks, then it's better for the patient, because when they do truly have that clinical question that only a physician can answer, the physician now has more time to deal with that.
So much of the conversation around the tools, especially around inbox management, workflow, office visit, PCP specialists, et cetera, has been around take 7 or 8 people on the back end to really take care of one patient. And then we have this huge, to a degree, almost like a demographic cliff approaching us. We have all this aging population for a huge surge for maybe the next 20 plus years. When you see tools like yours and even others that you may be utilizing that are complementary, does it take your panel size from 1,500 to 2,000 up to 5,000 because of the ability to automate so much of the workflow? And as a doctor, is that really where you want this to head? Or are there more eloquent ways to not say, I'm going to give you a 5,000 patient panel versus the ability to just be very thoughtful about the interactions you're having, maybe with an increased size? But how is Switchboard MD getting in front of some of that dynamic as you look at the future of what else you want to bring forward for yourself and for your patients?
So I think that the 5,000 patient panel probably wouldn't be great for anyone, because I think it'd be very hard to maintain the personal relationships that really can make it unique and special. And I think that one of our key focuses is trying to improve the human connection, not replace it. And I think that if it becomes more factory-like, where you have 5,000 patient panels, then it's very challenging. But I think that I want to cover one other thing here. I think that the aging population kind of highlights something else too, where this is a multifactorial problem. And online messaging is one component of it. But one of the areas we're focusing on is meeting patients where they are. Not everyone is signed up for the online portals. Some people prefer just to call in and talk to an agent or leave a voicemail or something like that. And that's one of the more exciting areas that we are, as a company, expanding into, is some of the other mediums. And I think that as the population's age and technological adoption being variable in different age groups, I think being able to handle different communication mediums, I think is important.
There are times when you want the convenience factor of the portal or a text. There are times, though, especially if you have a pretty chronic condition or something has happened that you weren't expecting, you still need to talk to a person, and you want your doctor's office to answer, not the call center who's going to direct it to make the appointment. You still want to be able to talk to the people that you've trusted with your care for so many years. And to me, that's where I want to continue to see medicine head, as technology can unburden you from administrative work so that you can actually spend more time with the same amount of patients or the ones that have higher acuity levels. That's what it's all about. And that personalization effect, like I grew up with my doctor 10 houses down, and people want that. They still want that connection to the person that they're trusting with their well-being.
Yeah, I think we're not quite to the point where people are ready to just give up all control and just go with any kind of anonymous doctor or chatbot or anything like that. And it's amazing. Primary care is obviously very unique with those relationships. And I used to always laugh at people who go see subspecialists, people who are experts in their field, have done more of a procedure than like anyone else in the world. And then they still would come back to me, the primary care doctor. What do you think I should do? Honestly, I think you need to listen to that person. But I think it highlights the importance of that personal connection and finding ways to make that better. I think is one of our main goals as a company.
Which is such an important factor when you think about how you're having the conversation to utilize these technologies. If you could advise healthcare leaders on one AI strategy to prioritize today, what would it be?
I think what I was saying earlier, and I think that making sure that it is a problem first, solution second situation. I think that's one of the advantages of some of the AI that's coming out, is it's easier to have very focused solutions, and it's not like a solution in search of a problem. And I think making sure that whoever's making the decisions, they're focusing on how is it actually integrating into somebody's workflow, and it's not going to make something even more burdensome than before.
And as you consider what you want our listeners to take away from our conversation, beyond what you've created, why you've created it, what's something that everybody needs to hear from a practicing physician about technology, about workflow, about adoption? What do you want people to know from you?
So I think that one of the key things is there's always going to be some amount of change management whenever you adopt a new technology. I think that finding ways to minimize that, make the adoption process as easy as possible. And that's one of the things that we have always focused on, is trying to minimize that as much as possible and make it as seamless into the workflow as possible. But the broader thing there is change management is very hard. And I've seen that firsthand in operational roles, and it can be very challenging. And it can be difficult to convince people to let go of their Excel spreadsheets.
Unless your OCM expert is using a spreadsheet to track all the outcomes and different stakeholder engagements. But I will share with you that I have always put OCM into any project plan whether it is a technology deployment or just something happening to people, because if you don't put that level of rigor around it, about 80% of your efforts are either going to fail or need to be retooled during the process. And that's when things get expensive and get messy. And when you really plan it ahead of time, it's amazing how well it can go.
Ounce of prevention is worth a pound of cure.
This was such a great conversation. Thank you, Dr. Blake Anderson, for taking time with us to share Switchboard MD, your background, the future of what you are going to continue to do with your product for your own health system and beyond. And we are grateful for your partnership and look forward to your continued growth.
Thank you very much.
For everyone tuning into our executive interview, thanks for listening. That's all for now.
Thanks for listening to this Interview in Action episode. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.